Public media funding is on the line. That means trusted interviews and important conversations like the ones you hear on Idaho Matters could be in jeopardy. Act now at boisestatepublicradio.org/funding. Help protect the journalism you count on. From the studios of Boise State Public Radio News, I'm Gemma Cadet. This is Idaho Matters. The Centers for Disease Control and Prevention has come up with a new plan for COVID vaccines this summer. In fact, it's dropped its recommendation that healthy pregnant women routinely get vaccinated against the virus. Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak, is joining us today to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email at idahomatters@boisestate.edu. All right, Dr. Pate, as I mentioned, the CDC has dropped its recommendations when it comes to healthy pregnant women getting the COVID booster. But I have to say, these new recommendations, which I believe came out about a week or so ago, I think there's a lot of confusion because I'm sitting here thinking, does that mean I can't get it? Does that mean my kids can't get it? So can we just first off start with what recommendations have been dropped?
Yeah, so let me add that I too am a bit confused by all of this. So I'm going to tell you what my read is as of this moment. I think this will be something that you and I need to revisit on subsequent broadcasts as we see hopefully more clarity as we get closer to the time for the fall boosters. But what has clearly been dropped is just what you said in the lead in, that the recommendation for vaccination of healthy pregnant women. This is really alarming because I think that there is a general lack of understanding that when women are pregnant, that there are changes that go on with women to kind of tamp the immune system down because you don't want the immune system attacking this little baby you're carrying. And as a consequence, even quote unquote healthy pregnant moms are much more vulnerable and at risk than healthy women the same age who are not pregnant. And so that is what is a major concern. We have extraordinarily clear data that pregnant women, first of all, do worse themselves if they are infected and have COVID during pregnancy and are much more likely to develop severe disease. And in fact, even at the same time that they took the recommendation away from vaccinating healthy pregnant women, the CDC website still lists, and appropriately so, that pregnant women are in the high-risk group. And so it makes no sense. But the other thing is that we know that in addition to threatening the mom's health, it threatens the fetus's health, and there is higher risk for stillbirth, for premature delivery, for neurologic problems with the infant. So this is a recommendation that I'm afraid people who are placing their trust in that are going to be putting both themselves and the baby at risk. The other thing is that vaccinating, as we talked about many times on your show, vaccinating pregnant women can be an effective strategy for giving infants in the first 6 months of their lives what we call passive immunity. In other words, they don't have to develop the immune response themselves. They get it from the mother, and they can get it through the umbilical cord. They can get it through breast milk. But what we see is that the rate of hospitalization for COVID in infants from their time of birth to 6 months is about as high as it is for people in my age group, those over
Oh,
65. It is very high. And if you look at those infants who are hospitalized with COVID, almost all of them was in the case of unvaccinated mothers. So we
mm,
know that vaccinating women during that pregnancy can protect them and their infant through birth and the infant through for the next first 6 months of their life. What the That's the only thing that is official, but what is
uh-huh,
creating more confusion is that Secretary Kennedy was in a video with the NIH director and the FDA director saying that they had removed the COVID vaccine from the healthy children and as well as pregnant women schedule, and that they were not going to approve COVID boosters for people under the age of 65 unless they had a comorbidity. So the question about what about for you? There's also going to be a question about what about for healthcare workers who are at very high risk
mm-hmm,
but aren't 65. There's a lot of questions. They are saying that they're removing it from the schedule. However, even when I recently checked the CDC site, it is still on there. The reason this is a big concern is that is in large part determining whether the vaccine will be paid for by insurance companies, whether
mm-hmm.
there's going to be a cost to people. And you and I have talked before about how expensive those vaccines are. So this is really a big deal.
Well, and getting back to pregnant women for a moment, Dr. Pate, I mean, I think back to my pregnancies, and I'll tell you, I never got a flu shot until I was pregnant because my doctor said I needed one so that I didn't get the flu, but also to help my baby when he was born, because babies can't get a flu shot right away. I've gotten a flu shot ever since. I mean, I'm almost 18 years, and I know COVID and the flu aren't the same thing, but I'm like, well, but if you still recommend the flu shot because you know the benefit of it for pregnant women, you are literally risking the health of pregnant women by saying they don't need a COVID vaccine.
Well, you bring up an excellent point, Gemma. They have not changed the recommendation for the influenza vaccine, yet the death rates among children and young adults is about the same between COVID and influenza. So again, this is another internal inconsistency that just makes no sense. Why remove that recommendation from the COVID vaccine and not the flu vaccine? And Lord heavens, I hope they don't hear me say that and decide, well, we'll remove the
Mhm.
recommendation from the flu vaccine. The point is that the fact that they're removing the COVID one and not the flu it certainly smacks of politicism and not science. And I do encourage listeners that the Secretary of Health and Human Services, the NIH director, and the FDA director are all saying that they are now using quote unquote gold standard science. Let me assure you, this is not gold standard. Please evaluate their recommendations very carefully with a healthy dose of skepticism.
So, what does this ultimately mean? At least, what do we know now? Because I'm thinking about my kids, other kids. You go back to school in the middle of August. I have always gotten my kids that booster in the fall. So and neither of my children have any pre-existing conditions, Dr. Pate. So does that mean A, that I will no longer be able to get them a COVID booster? I guess will there even be a COVID booster this fall? But also if I can get it for them, does that potentially mean out of pocket expense, which then we very well know that anyone in a lower economic status is going to be adversely impacted by this?
Yes, I think it's several implications of this that we have to watch carefully. First of all, that if this recommendation is ever officially made, that you're right. Number one, you may have access, you may have trouble accessing the booster shot because as some of our listeners who have written in said, I got turned away at the pharmacy because they felt like I didn't meet this criteria or that criteria for their COVID shot. And so one is it may impair access. The second is even if they do go forward with this, you should still be able to get the vaccine, but it just means that you would likely have to pay for it out of pocket, and you might have to get it from your doctor instead of going to like the pharmacy or something. It's going to be a major obstacle, and the problem is this is a failure to understand or appreciate a point that I have tried to make repeatedly for the past 5 years. Do not base all of your health decisions, and more specifically, like we're talking about COVID boosters, purely on the risk of death. There are plenty of people who suffer very severe complications or very long-term complications. We've talked about MISC in children where they get severely ill. We've talked about long COVID and people that it can no longer work or have severe restrictions on their activity. We've talked about less, but we've mentioned that there's been evidence of excess deaths in particularly relating to heart attacks in people that are over 20 and under 65. And we know that getting COVID increases your cardiovascular risk for at least a year. And so there's lots of reasons besides when these people are just saying, well, the kids don't die from COVID. Well, first of all, that's not technically correct. Some do, but fortunately, most don't. But there's more reasons to think about this. And then I'll just add that the other concern that comes to my mind when you say, where are we going with all this? Well, this was extraordinary. The ACIP, the Advisory Committee for Immunization Practices, was scheduled to meet this month. And they are the body of independent experts that come together to consider these vaccine recommendations. When Secretary Kennedy came out and announced this, that is the first time, to my knowledge, that a Secretary of Health has ever done that. It has generally been up to the CDC director. And we've and the CDC director, to my knowledge, has never acted before getting the recommendation from ACIP. So it concerns me that the secretary is inserting himself. And while he says publicly, "Don't take medical advice from me," he is setting the medical standards that are available for us, and he's doing it without the benefit of these experts. So I am worried. I'm watching. I'm afraid that this is only the beginning and that we could be in for much more threats to our immunizations in the future. I hope not, but we'll watch.
Another thing I want to talk about, Dr. Pate, is that the Health and Human Services issued its Make Our Children Healthy Again assessment. In theory, this is a great idea, right? Let's get our kids healthier. Let's figure out, maybe why we're seeing chronic diseases in children. And the report did identify 4 potential drivers behind the rise in childhood chronic disease. I want to say what they are. Number 1, ultra processed food. Number 2, environmental chemicals. Number 3, lack of physical exercise. And number 4, over medicalization. Now, with that said, Dr. Pate, this report literally referenced non-existent studies. So where do we get this information? It's shocking.
It is. Even when I keep telling people I just don't think I can be shocked by anything anymore, I get shocked every day. I have taught in medical schools. I've taught in law schools. I would fail students that submitted a paper that looks like this. You're right. First of all, this is a very, very important health issue. We do have an epidemic of childhood obesity. We do have concerns that have been well founded and well demonstrated about the adverse long term effects to our health from ultra processed foods. There are some environmental concerns, most lately. The microplastics and
Hmm.
because we're seeing it does get into our bodies, and we need to be studying what's the effect of that and what do we need to do about that. And of course, lack of physical exercise, a very big concern. When I was young, of course, I got home from school, did my homework, then I was out in the street running around playing until the street lights came on, and I had to come home. Very active, but now of course, parents are having to struggle with their kids just being on their phones or other
Hmm.
devices. And not as active, and so we're seeing higher rates of childhood diabetes and other things, and so this is a very important topic, and it deserves the best of our thinking and the best of expert input. However, it's not even clear how much expert contributions were made to this document because, as you said, there were studies cited that don't even exist. Some authors of articles that were cited said that's not what our study showed that was represented in the report. And there have been some media outlets who have done some forensic analysis and quoted as high as a 95% chance that substantial amounts of this paper were written by AI. And look,
Hmm.
I don't have anything against AI, but I know when people have brought me things written by AI before, it can make stuff up, and so you have to go through it, and you can use it as a guide and a help, but you can't just do that. And I think the lack of serious academic discipline for this report undercuts how important an issue this is and the steps that need to be taken in this area.
And then on top of this, Dr. Pate, the United States, the Health and Human Services, canceled a contract with Moderna to develop bird flu vaccines. Um, Again, I am stunned by this. I mean, the bird flu has not gone away. I believe you and I have been talking about it for more than a year now. With that said, Moderna was doing this for future flu uh, pandemics, right? In particular, flus.
That's
How
right.
big of a how big of a setback is this, Dr. Pate?
Well, it's huge. And look, I have said you're right. We started talking about this in March of 24, and here we are in June of 25, and the outbreak of the avian flu or a bird flu is still not under control. And
Mm.
we have talked about very concerning things that have happened. I cannot tell you whether this is going to become a pandemic or not, but I can tell you that we have had influenza pandemics in the past, and they've all had origins in avian influenza viruses. And if somebody wanted to hire me to write the screenplay for a movie that would kind of show you how a pandemic evolves, we're seeing it. And so this is very foolish because even if a bird flu pandemic does not result from this, we would learn so much that can be applied to our other disease threats and vaccination strategies from doing this work. And as we've talked about before, the if this were to materialize,
Mm.
Based on what we've already seen from infections over the course of history, where this particular H5 bird flu has infected people, um, uh, we would expect mortality rates to be more than a factor of 10 higher than COVID, very possibly in the order of 20 to 30
Mm.
times more fatalities with bird flu than with COVID. And we do have some evidence that would suggest that, unlike the COVID attitude of, well, it's just old people and they've got to die of something, well, avian flus are much more likely to impact children and young adults more severely. And I can tell you that as our health system got, I'm talking about across the country, the
Hmm.
healthcare delivery system got overwhelmed during a couple of points in COVID. um, our pediatric infrastructure is far less than what we have for adults because children don't usually end up in the hospital. We would be overwhelmed extremely soon. And what we've seen is this is a huge threat, and this is very foolish. And because we could see this materialize at any point. You just never know when it's going to make the final changes that could cause a pandemic. Very short sighted.
Uh, and then on top, and then next thing I want to talk about, Secretary Kennedy is now threatening to not allow NIH funded research to be published in traditional medical journals. Why, Dr. Pate? But also, what does
Uh,
this mean?
well,
That was a
I'm
big
just
sigh.
that was a big sigh, and
Yeah.
what you can't see is I'm also shaking my head. So the problem that the disinformation purveyors have with the traditional medical journals is that a lot of the things that they have wanted to publish that has been basically nonsense gets rejected by those journals because those journals have peer review. Now, we have certainly seen numbers of occasions where articles have still gotten through peer review only to later have to be withdrawn when they've been shown to have been fraudulent or erroneous. But the traditional medical journals are the places that I go and respected leaders go to keep up on the latest research that is going on. When you go outside of those, there are journals. This is a big business, and there are journals that will, some of them will pay people for articles, which the traditional journals do not. That you do not get paid
Mm.
for writing a journal article. And so it can be a source of revenue, and they don't have the peer review, so they can just publish nonsense. And I think that what this is an effort to try to legitimize some of this, some of these notions that are being perpetuated that cannot be founded in science. Yet they are broadcasting that, look, this is the gold standard science, which it is not, and an opportunity where they're trying to legitimize it by saying, see, it's in XYZ journal, even if that journal is not reputable, doesn't do peer review, and the information can't be trusted.
The last thing I want to talk about today with you, Dr. Pate, is the fact that the Trump administration recently cut $258 million from a program that is directed at finding an effective HIV vaccine. I am assuming that by cutting this funding, this is stopping decades of progress when it comes to HIV.
You are correct in your guess. So the HIV, that virus, is a incredibly difficult virus to prevent infection and to cure infection. And it's because it has adapted ways to actually invade the very cells in our body that fight off infection, and it destroys those cells. It has been extremely difficult to develop an effective vaccine to this virus, but we have learned tons about the virus, and we're learning tons about new vaccine approaches and new ways that we can trick the virus into exposing itself, so that not only might this research have benefit in preventing or treating HIV infections, this could help us with other related types of viruses. I would remind people that HIV was also a zoonotic virus, meaning that it started in an animal and spread to humans. There are other viruses like that. And even if you are one of these politicians or of a certain mindset that you are not empathetic for the stereotypical and stigmatized HIV patient, it should be in everybody's interest to learn more and be able to treat these other viruses, although I think it's reprehensible for us not to want to treat and cure everyone. And remember, a lot of the people who get HIV are the babies born to mothers that they have HIV and maybe didn't even know it. And now we have babies, we have the risks of HIV getting into blood supply, all kinds of other things that just ending this research is going to set back tremendously. It's a terrible shame. It's really just part of this further attack on science, as I have talked about before, and very discouraging.
Well, as always, Dr. Pate, we so appreciate you and all of the factual expertise that you bring to the table for us every week. We've been talking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have any public health questions for Dr. Pate, you can send us an email, idahomatters@boisestate.edu, and we will do our best to answer those questions next week. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you're going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.